I mean, as a practice.
Yes.
Irv Yalom, how important is it to keep death in our minds? I mean, particularly for people who aren't necessarily experiencing the terror of it or plagued by the terror of it.
Well, we can't stay in that white heat all the time, but I think as a background, the willingness to look at it in the same way this caller, is it Bonnie, is it?
Bonnie.
About Bonnie. You know, I want to ask you something, Bonnie. Have you been able to continue your therapy practice with your clients during this time?
I'm not a therapist.
Oh,
I actually teach mindfulness.
Oh, but these groups you're leading then are, let's not call them therapy groups, but I assume that they are therapeutic groups.
Yes, they're deeply therapeutic, and yes, I actually had to deeply consider whether I would start new groups, and yes, I have. I continue to lead 6 groups through this year-long process.
Well,
It brings me even closer.
Well, I'm really interested in hearing that. I mean, that's an extremely courageous thing to do, to sort of use your own pain and your own new awareness to really pass this on to others, and in an indirect way, of course, by offering others a sense of meaning. You imbue your own life with meaning. I've looked at some therapists. I know therapists who, the instant that they've gotten the diagnosis, stop their practice the next day. And I've known other therapists, and I talked about one of them in my book, The Schopenhauer Cure, a therapist who had a fatal diagnosis, but he decided how did he want to spend the last year of his life, and he thought he liked the way he was living. He felt it was deeply imbued with meaning, so he practiced until the very end. And I think that's a choice that perhaps you're making as well.
I am.
I applaud it. It's wonderful to hear that.
Let me thank Bonnie for the call, and we'll go to Memphis, Tennessee next, and welcome Jacob onto the air here. Good morning.
Hey, good morning. Basically, I was listening to your program, and it occurred to me about how many people have feared death because of their dogma, what they will fear at the end of their life when they actually have to face death. I guess certain dogmas apply a certain level of fear within a person of what they have to answer to at the end of their life, and I think that's a big hang-up in a lot of cultures as far as facing death. Just the fear of not basically dying, of what they will have to answer to at the end.
That was, I think that's a really important question. Maybe that was a little bit more relevant and more important in past centuries when there was so much fear of the afterlife and death and hell. When I talked earlier about Epicurus, that was one of his first arguments. His first argument was based on the fact that there were so many religious leaders at that time who were gaining power by frightening their congregation about what was going to happen to them after death. So he started his arguments about death anxiety to ameliorate death anxiety by saying, first principle is we are mortal. We have no afterlife, and therefore we have no fears. We can have no fears about what will happen to us. The gods, if there are gods, cannot harm us in the afterlife. He believed that there were gods, but they were somewhat oblivious of our life, and the way he felt that we could learn from gods was to view them as a model for bliss and tranquility, how we could increase our virtue and live a life of bliss, or as he termed it, ataraxia, forever. So yes, I think your point is very well taken.
Just drink the nectar, right? Like the gods did up on Olympus. Here's a listener who says, I have experienced death anxiety as early as I can remember, certainly at least since I was about 4 or 5 when I first started my awareness of my own mortality. I experienced severe bouts of death anxiety right before I fall asleep, but only rarely during the daytime. Is there an explanation for this? Well, you write in your book about sweet Morpheus and how close sleep is to death. I mean, it's probably the closest we can have true cognition of death.
That's right. The Greeks had two of their two other figures, Hypnos and Thanatos, sleep and death, were twins. It may be the closest we can get to a certain kind of awareness of mortality. But the other point you're making, I want to say just a thing or two about that. I do go into that a good deal in Staring at the Sun. The idea that there is a kind of developmental, life development of awareness of death. And I think your comment about being aware of it quite early in life, I find that is very true for a great number of people. That death awareness starts at an earlier age than most adults imagine. You go back to your own life. We become aware of death when we see evidences of it. See evidences of it in dead insects, falling dead leaves, and then, of course, then dead pets, which is often a great shock, and then the death of a grandparent, or maybe an early attendance at a funeral. And then it sort of goes underground, maybe after the age of 6 or 7. Freud talked about the great sexual latency where all of our infantile sexuality goes underground for a number of years. Well, I think the same thing happens with awareness of death, and it reemerges again for many of us in adolescence. So adolescents are acutely aware of death, and one of the ways they cope with it, I think, is we can use a professional term, maybe counterphobically, which is, in other words, they go into the face of it. They go to horror films and have a fascination with horror films, or they
court it rebelliously in many instances,
that's right.
too.
Daredevilry. They take chances with it. And then when the two major tasks of adulthood begin to settle in, which is forming your family, raising your family, and pursuing your career, I think then death again goes underground for a long time, 20 years or so, and reemerges again in what we often think of as the midlife crisis in our 40s and 50s. And from that point on, I think we're perhaps never entirely free of it.
Couldn't help thinking, though, with that listener bringing up sleep, and, there's a wonderful novel by Henry Roth called Call It Sleep, which you may know.
I do know.
And the mother, who's a very loving figure in the novel, says to the son, you might as well call it sleep, trying to explain what death is.
Right.
It's just a sleep. It's, it's Raymond Chandler type of sleep, too. I mean, that's how we understand it, and yet we really don't understand it. I mean, there's just so many things that are impenetrably mysterious about it.
Yeah.
And we'll go to Alamo. Ruth, you're on. Hi.
Okay, hi. This is Ruth Nathan. Thanks. I love Forum. I just wanted to call in. I'm 62 years old. I'm a grandmother. And when the doctor talked about moving into that state of mindfulness of being, right away my ears perked up. Within a couple of years, my husband and I was diagnosed with cancer, breast cancer, and my husband had open heart surgery. I'm actually taking care of my grandchildren now.
Yeah, we hear.
But I just wanted to say that having... I'm the editor, or maybe I mentioned that already, of Grand Magazine, the child development editor, and I can't tell you how that diagnosis, both for my husband and myself, affected our relationship with our grandchildren. I thought perhaps maybe you'd want to talk a little bit about this, but you just talked about into the face of it, getting into the face of it. Well, there are lots of ways of approaching that, and one is, I think, thinking about your grandchildren and what you do on a daily basis with them as an approach to thinking about into the face of it. Does that make any sense?
Yeah, this is exactly the point. I think it's a wonderful example, exactly the point that I was making, that I think, your diagnosis, your husband's illness moved you into this state of greater awareness of death and changed your life, so that you began to put the important things, really gave them greater priority. So this is a wonderful example of an awakening experience. But we could also say that, yes, you got a diagnosis at that point, and your husband did as well. But in fact, we don't need to wait for that diagnosis, because if we are aware of it, we all have that diagnosis, that we're mortal from the very beginning of our life. In my book, I describe a short essay by Freud written long time ago. But he talked about taking a walk with the poet and a colleague, and the poet lamenting the fact that what a tragedy it was that everything passes, that everything will turn to dust eventually. And Freud was making exactly the opposite point. He says, no, you're wrong. It's exactly the opposite. The knowledge that everything passes makes things more beautiful, makes things more invested with poignancy and preciousness. So you're coming close to saying exactly the same thing I think he was saying in that wonderful essay.
And thank you, Ruth. Here's a listener who says, I've been a slowly worsening chronic pain patient for the past 9 years. I've often gotten to the point of considering whether it would be better to be out of pain rather than continue this life. It has changed my attitude toward death, as it will be a relief to me in the sense that my pain will stop. At the same time, there is no way I can leave my wife, children, extended family, and friends behind.